You've got questions?
We've got answers.
Tune in Tuesdays at 12 on Facebook Live and Instagram Live, where we will be hosting a variety of community experts that will answer your questions.
Hi, it's Kristy Case, Oncology Social Worker and Therapist. Join me as I talk about patient navigation through cancer on Tuesday, March 16th.
All right. Hi, everyone. How are you? Welcome to Tip Tuesday. It's Jillian.
And Michelle.
And we have a very special guest today. We have with us the beautiful, amazing Kristy Case. Kristy is a licensed clinical social worker in oncology out of Jersey City Medical. She also is a therapist with a private practice in Morristown, and we can give you more information on that. And she is someone that is so important to our community and how we navigate things. So we are so thrilled to have her with us today. So please, if you have any questions or comments, just drop them right in. If we don't get to it right away, we'll definitely pop in later. But before we start pounding Kristy with questions, Michelle, do you have any housekeeping to do?
I do. I have exciting housekeeping, Jill, because as you know, everyone out there, we had Josh from Lymphedivas on last week, and we had a giveaway, which was a $150 gift certificate to their website, and we have a winner. So thank you everyone who participated and put comments down. We put them all in a hat, and we pulled a name, and the name is Sally Kinter.
Yay!
So congratulations, Sally. DM us, and we'll give you information on how to contact you with Lymphedivas for that $150 gift certificate to their products. And also for all of you out there, there's still time to get that 15% off any purchase until this Sunday, and you use code BEAUTY21. So there's still time to shop 15% off at Lymphedivas until this Sunday. So that's our housekeeping, and congratulations, Sally.
Yay. Okay. So shall we go ahead and ask Miss Kristy?
Oh, yes.
All right, let's get to it. Kristy, thank you for being with us today.
You're so welcome. It's a pleasure to be here, and I'm really grateful that you asked me to do this.
Awesome. So I want to start with, I think personally that there is a big misconception with social workers that they're for people that may find themselves in devastating all the way opposite end, extreme financial or extreme emotional or mental difficulty. Like once the problem is at level 10, but that's not exactly true, is it?
It's not true. People can seek out an oncology social worker even when things are brand new and they're stressful, or things are years later and maybe they're still stressful, or anywhere in between when they're not very stressful. I try to think about it like proactive with our health, right? We're proactive in terms of trying to eat well or sleep enough or get enough rest, proactive in terms of health screenings. And you can be proactive with seeking out your oncology social worker. Even if things are going okay, it's okay to reach out to us just to touch base and even just know who we are, so that we're a familiar face and that you can contact us maybe before a crisis actually happens, if it ever happens.
That's really good to know. And I would love if you could really clear for us exactly what is it a social worker does? Like, who would want to connect to you before crisis hits?
Great question. So social work in general, we have a really, really wide variety of things that we do. We can work in hospitals, people work in schools, people work in health centers, with children, with adults, with older adults, with people with varying abilities. So social work in general is a really, really large umbrella term. In the world of oncology, it typically looks like someone that might work in a cancer center or may work for some type of nonprofit related cancer organization, or something to do with there is some connection to cancer. In general, as a hospital social worker, most oncology social workers are there to provide a variety of different types of support. So everything from emotional support, which is what most people, usually think of when they think of a social worker, is, we do things like counseling, we run support groups, we teach people how to manage stress and anxiety. A big part of what we also do in most centers is we're big educators. We want to make sure that you understand your diagnosis. We want to make sure that you're seeking out information from reputable websites and trusted people. So we are definitely there to also make sure that you're informed and educated in an accurate way that is fact-based. Because as we know, unfortunately, the world of the internet, you can find anything you want out there. So we really want to make sure people are getting reputable information.
Well, go ahead. No, you go ahead.
I'll just finish with, we also help with some of the practical day-to-day life encounters. Everything from finances, like how am I going to pay my rent for the month or pay for this medication? It could be things related to talking to your kids about cancer. It might be how to manage being a caregiver to your elderly parent while you go through cancer treatment. A lot of people find that they're very unfamiliar with how to ask for help. That's one of the biggest struggles that I actually see women come in with, of like, I don't really know how to do that. I've never had to do that. Or I've just assumed the role as everyone's caregiver, and I really don't know what I need or how to ask for what I need. So even something that seems kind of seemingly simple, it can be really great to dialogue with a professional that understands this and can help people work through some of these things, but also can address these other practical, educational, financial, spiritual needs that often do come up for people.
I like that. Well, actually, I love that you said that, because I think, especially as maybe men too. Now, I'm going to throw men in there too, but we are programmed for the most part, I think, to be kind of embarrassed to ask for help.
Absolutely.
And cancer is such a game changer, because you can be well off, middle class, whatever, all that, but cancer can shatter those norms that you've had. So you just have no idea where to turn to. And I think the other thing that you said that was really important was, I remember, and I know some of the gals in the chat who have gone through this, when we first are diagnosed, and I'm sure this is where you work too, they introduce you to your team. This is your team. Here's your social worker. This is this, this is this, this is this. And you don't really realize, if you've not experienced with it, how important the social worker is to that dynamic. I think we tend to focus on the nurse and the doctor and the chemo nurse and those things. And then I can tell you, as even as I started to go along in my journey and post, my social worker became probably one of my most important components as to how I navigated everything. So I want to ask you, because definitely do not Google. That's the number one thing my doctor said to me. She's like, I'll kill you if you Google anything. I'm going to kill you. Just ask anything you need to know. And I would just be curious to know, since we really focus on the survivor and metastatic community, is that, are most of the people that you see and, and help out, are they in active treatment, or are they mostly post initial treatment? And do you see a big metastatic group? Like, I think people think, we're survivors, we're done. So.
Yeah. Well, that I think is one of the bigger challenges that a lot of people do experience, is there's an assumption that once you finish treatment, if you finish treatment, that, services and support are no longer provided to you, which is not the truth in most situations. I can't speak for every cancer center across the country, but in general, I can say that support is absolutely still available for people, whether they finish treatment or whether on a maintenance treatment or they're on long-term treatment because of their metastatic disease. I would say a majority of the people that I've experienced, when they actually seek out social work support, it tends to be either in the middle of their treatment or after their treatment has finished. In the beginning, most people are very overwhelmed. They're trying to process everything. They're adjusting to, side effects of treatment or healing from surgeries, etc. And so people are usually, their plates are pretty full with doctor's appointments and managing phone calls and well wishes from people, that once those types of things start to settle down, which they usually do for people, they find themselves feeling a little bit more alone and isolated. They find themselves a little bit more in their heads. a little bit more less on the doing something about cancer and kind of sitting with the experience of cancer. And that's usually the time people come for support. And I encourage people, whatever point in time it is that you seek support, whenever you're ready to do it, if you're ready to do it, that's when you do it. There's no timeline, there's no right or wrong. It's a matter of when you feel ready. I also encourage people to not necessarily wait until a crisis has erupted, because that's certainly an opportunity to seek help. But I encourage people, come the step before the implosion happens. Just like with any health condition, we want to be proactive in someone's mental health care.
I do want to tell you that Shannon Mulvey is sending a lot of love to you. And she just said, she was instrumental in helping with my own personal journey. I have sat across from her in her office, crying my eyes out, and I will always love and appreciate her. So Shannon's giving you a lot of love in the chat right now. And, I have to say, you said something, it actually gave me goosebumps because I even wrote it down. You said there's a difference between doing and experiencing. And, we all, I think a lot of us, I assume all of us, but there's that meme or magnet that says, if you're going through hell, keep going, right? So you're going through hell, you're in the fire and you're like, hot, 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 got to get through, got to get through, got to get through. And you're right. It's not until maybe even 2, 3, 4, 5 years later, when you're not completely settled into the now self, you're like, what the hell? Did I just go through fire? Like, what the hell just happened? So I love that you said that. And I want to ask you, what are some of the most common things that you see survivors deal with when they come in years later?
There's a few things. Probably the most common ones that I see. First, if someone has completed treatment, fear of recurrence, that's probably the number one concern. Again, I think this speaks to the I'm no longer doing something. I'm just supposed to go out and live my life, but my life has forever changed for a lot of people. And so I think that is a huge concern because, as everyone knows, you go for follow-up when you've had breast cancer treatment, whether that's mammograms, MRIs, blood work, tumor marker tests, whatever the case is, there will always be some type of follow-up going on for the years that follow your diagnosis. And that is an incredibly anxiety-provoking experience for most people. The other thing that I find a lot of is people are adjusting to their bodies. It's likely that their body has changed in some capacity, whether it's from surgery or chemotherapy or skin changes. The body is different. Fatigue is different. Recuperating from things is different. And that is a really big struggle because I think in the world of outside of cancer, there is a real big selling point of life will go back to normal and everything will be okay. And you'll just get to go live your life exactly the way you hoped for. And that is the case for some people, but for a lot of people, they're adjusting to their body in a completely new way. And, if they have a partner or partners, that also brings up a lot of concerns of how do I, engage with my partner with this new body that I may not even feel comfortable and safe and familiar with. And so a lot of body image, comfort with the body, intimacy issues with partners comes up. Because again, I think when people are in their active treatment, I don't think people have a lot of expectations that they're, having to adjust to their body or intimacy with their partner. It's usually not on the radar. Yeah. And then lastly, I would say for people, that are going to be on ongoing treatment with metastatic disease, how do I live my life knowing that my life may be shortened? I think obviously we all as humans understand, that we will not live forever, but it's completely different when you're told that you will not live forever, the way many people kind of float in the world thinking that we will. And so how do I make use of time? How do I make this meaningful time? Do I want to work? Do I not want to work? Can I not work? What's going to happen financially for me? I think there's so many big life questions that come up for people with metastatic disease that life has to be lived in a very different way for a lot of people. And having to adjust to that is a huge adjustment. And a lot of people seek out a social worker when they're trying to figure out what are the next steps I take to start to live my life with this new diagnosis and this new schedule of treatment and these new doctor's appointments. And, it's an enormous adjustment for someone to have to make when
it's
the
really
world is cheering you on.
Well, yeah. And it's really, like you said, it's just so overwhelming. And what I love about what you do is, so you are pretty much, I would call you the channeler, you're the channeler, right? So that someone, could come to you and say, I don't even know how to begin to start, where to look with these bills. I don't know what to do about my emotional health. I don't know what to do. So you can start to lay out a plan for them. And that's what you need, because it's all so overwhelming. And I know we're going to talk about resources to help us deal, and that's important, but I just want to, I want to just kind of preface the resources with something else. And that is, I don't know if anyone out there has noticed now that when you go to your doctor visits, which, as you know, survivors and metastatic and those who are just being freshly diagnosed, like it's all doctor's appointments 24/7, and you fill out a form, they ask now about depression and anxiety. And I have to say that about 2 years ago, I was red flagged, and I wasn't filling out anything, like I was just answering very honestly. And I didn't realize that I had been stuffing so much like trauma, because I was like, I got this, look at me, like I'm always out there pretty happy doing my thing, that it was coming out in horrible ways. And so I was able to get that help. And I think it's so important, that mental health conversation. And my point to all this is, I took all those things that were happening to me personally, and I normalized them. No, it's normal to feel this way. It's normal to have this. It's normal to have that. And it was destroying my life. And my doctor said, it's not normal. You need to get therapy. You need to get help. So how do we know when to take those warning signs seriously rather than normalizing the trauma that we go through?
Sure. And I'm glad that you're using the word trauma. I don't think that word is used enough when it comes to cancer, but cancer is a traumatic experience for most people. So the way things are set up in general across the United States is for a cancer center program to meet its certain credentials or certain standing. Everyone should be having what's called a distress screening that happens on pivotal visits. And so it's one way that we can identify with people what is really going on in terms of their emotional health, but any other concerns that they have. Some cancer centers and doctors' offices take it a step further, and they do formalized depression and anxiety screenings. Like, for example, there's something called the PHQ-9, which assesses for depression. I want to really encourage people to be honest when you're filling out that paperwork, and when your doctor's asking you how you are. You don't have to respond with fine if that's not really how things are, because the quicker we can get to you to find out what's going on and give you the appropriate support that you need, the better things can usually get. But I know, we live in a world where mental health care, although there's a huge light on it now, it's still not a priority for most people. Depending on someone's cultural or religious or community background, it may not be encouraged or deemed as okay to seek out this mental health care. And so a lot of people may be missed just based on some simple things like nobody asked. And the power of asking, how you are and not just accepting fine. When I meet with people and they say, I'm fine, I say, okay, tell me how you really feel. Because it's very hard to feel fine when you're going through cancer treatment. Even in the best of circumstances, it's still really challenging.
Yeah. And I love that you said that. So, because those questions on that list are actually, I think, written in a way that it does help the doctor dig deeper, because they're just like, are you sleeping? And I'm like, no, or are you having this or having that? And you're like, yeah, no. And it gives them that ability to red flag it, because we will normalize it as women. We will, because I'm not a mom, but I know there's a lot of moms out there, and they're trying to work, balance their child's and their children's life while they're going through their own trauma and their marriage and their jobs and their career, like all of it. So it's okay, is what you're saying, to say it's not normal that I feel doom and gloom all the time. It's not normal that I should feel this overwhelmed. Like, it's okay to say it. It's okay to say it out loud. Okay.
Absolutely. And, I think something that's really important is everyone's definition of anxiety or stress or not feeling normal. That's different for everybody. There are people that have incredibly high pain thresholds, whether that's physical pain or psychic pain. And so I think it's really important for people to say, this doesn't feel right for me, right? If I'm typically sleeping 7-8 hours a night and I'm suddenly sleeping 4 or 5 hours a night, and I find myself having a hard time sleeping, or I'm waking up a lot, or I just feel really unsettled, that wouldn't be normal for me. But there might be people out there that sleeping 5 or 6 hours is very normal to them. So I think it's really important that people are honest with themselves, does this not feel normal to me? Do I feel more sad lately? Do I feel more physical pain that's probably not explained maybe by my treatment? Do I have more headaches? Am I not sleeping well? Am I snapping at people? One of the biggest red flags I tell people is look at how you're treating strangers. If you're noticing that you're being mean to the cashier, it's because you might have some anger and it's coming out sideways at the wrong person, right? If you're having more honking of the horn and road rage, pay attention to that. It's probably telling you something. And the last thing I'll add too is family and friends often realize that something's going on as well, and they often hesitate to say something. They feel like, gosh, they're going through enough already. I don't want to tell them that they seem, really down or really depressed, or that I think they need help. But I want to encourage family members and caregivers to very lovingly say, I'm concerned about you. I'm noticing some changes, and I'm wondering if you feel like you need some help. And if you do, I'm happy to help support you in that. Because that's actually how a lot of people end up to me, is because their caregivers actually kind of nudge them in my direction, because they're recognizing that, the person with cancer just doesn't seem like like their usual self. And so I encourage caregivers and family members very lovingly to say, I'm concerned about you. And if you need some help, I'm here to support you in getting that help.
I do want to say hi to Laurel, who's watching. She's a beautiful self-liaison. She's wonderful. Can't wait to get back in to normal life, Laurel. And that Dina, who is our board president, she's out there watching, and she is a metastatic gal. And she said, and I think this is really, really important. She said, I think we get used to making people feel okay about our diagnosis. So we're trying to make the world feel better while we're taking it all on, saying, because that's what we do as women. That's what we do. Absolutely. So this is, I know we're going to talk about resources, but I want to ask you, you're a therapist also, right? Where is your practice? Tell us where your practice is.
So I have an office in Morristown, New Jersey, right off the highway. So I'm very accessible, free parking as well, which I know is not always easy to find in Morristown. But I also do telehealth visits as well, which I've been doing before COVID. And so as a licensed clinical social worker in the state of New Jersey, I am able to see anyone as long as they're physically in the state of New Jersey if they wanted to do virtual visits.
Okay. And I want to ask you, should we go, what's your opinion? You're professional. Should we go directly into therapy after initial treatment is over? Would that just be the smart thing to do? Or should we wait until we start seeing little signs? What do you think is the best thing to do?
Well, I'm a little more biased as a mental health professional. And I think, everybody should go to therapy, cancer or not. But I would say in general, it's great to be proactive if possible, but I also know that psychologically that being proactive takes a lot of courage. It also takes time. Sometimes it takes money. Sometimes it takes availability. And so obviously I want people to be as proactive as possible, but I also understand that that's not always possible for everybody. And so if you go when things are starting to feel a little off for you, that's a great time to go. If you go when things are really exploding and imploding, that's also an okay time. But just like with anything, being proactive about your mental health is really important for your mind, body, and your spirit, just like eating well, going to the doctor, exercise, mental health should be in that mix too.
Well, I really have to say, I agree with you. And just as an outsider, and I'll tell you why, another thing that we talk about within the support, survivor support community, metastatic community, is that we're so used to having, this is really more I think the labeled survivor community. We're so used to having appointments to go to, and then it stops and they're like, come back in 6 months. You've been doing this for sometimes up to 2 years. So you feel like you've lost your family. Your doctors and nurses become a family to you. So I feel like getting right into therapy, it's an ease out of that world. It's not a hard transition that we get hit with. So I'm gonna agree with you and say I wish I would have gotten right into therapy and not waited so many years and thought I got it, because they definitely didn't. So
Yeah.
okay, so as we kind of roll, you've given us so much great information. Can you give us some real resources to help deal with the things that we talked about, like real hardcore resources?
Absolutely. So for anyone that's interested in finding a therapist, there is a great website called psychologytoday.com. That is probably the #1 website that therapists use to market themselves to their clients. And although there is not a specific category to check for cancer, there is one for illness. And that's usually where anybody that would know about cancer would likely indicate they have some expertise. There's also things like trauma, anxiety, sex and intimacy, marriage, any issue that someone, might be experiencing. There's a lot of options to kind of narrow your search and find someone. So psychologytoday.com, it does not cost you anything and you can search for a therapist. I always kind of joke with people and say it's kind of like online dating. There's a profile, there's a picture, you get to read about somebody, you get a vibe of whether or not this person seems like they'd be a good fit for you. You can always ask for a free consultation with a therapist just to see if it feels like the person might be a good fit for you. I know I offer those, and in general, therapists usually do. I'd also encourage, looking at things like support groups. There's a lot of wonderful organizations out there that offer support groups. There's a few, in our area, like Cancer Care, for example. Their support groups are run by oncology social workers. They're completely free of charge. Prior to COVID, they had some in person. Now they have a lot of virtual ones, but also message posting, intranet-based ones that are really phenomenal and catch people from all over the country. There's places like Cancer Support Community, which most cities and some towns have a cancer support community in them. Again, completely free of charge. They offer a lot of help for patients. Some do offer counseling. A lot of them offer groups and a lot of wellness activities. Again, that's for patients and caregivers. Those are probably the two bigger ones. And then I encourage people, at wherever you get your treatment, ask your doctor, ask your nurse navigator, your social worker, a patient advocate, ask them what's available in your community. There's a lot of wonderful small organizations who are doing incredible work. Oftentimes it is free in the world of cancer. And so there's so many places that are very small. Maybe they just have a really small staff and people know about them because they're local to that community. But I would really encourage people to ask the people from their treatment team, what do they recommend in terms of breast cancer support organizations in the community? Because one of the best things about breast cancer, if there are any good things about it, is that the support is absolutely available. There is a ton of support for breast cancer. Most of the time it is free. And so I really encourage people to ask about it and look around for it. There's also bigger organizations like Living Beyond Breast Cancer. There's places like Young Survival Coalition for young women with breast cancer. A lot of these organizations have meetup groups, online programs, ways to do like virtual visits with people. A lot of them have a volunteer component. A lot of them run conferences. So it's a great way to connect into a lot of wonderful resources. And then you have things like American Cancer Society. That's also, they're located all across the country. You can call the number and they will direct you to what resources are available in your community. So there's always something out there. Sometimes it's just a matter of like Googling and sometimes it's a matter of like asking the people that you've actually been in contact with. Maybe you know a person that's a breast cancer survivor. Maybe you know someone that's in treatment or had a family member in treatment. Just ask them, hey, what have you done? Where did you find support? They'll tell you.
Well, I love it. Okay. So really I encourage anybody like to just even that last 4 or 5 minutes, you just gave so many resources on that to go in and click to, to reach out, to get therapy right away, use your social worker, your oncology social worker, and you know what, take distress screening, answer honestly, and it's okay because, going through something is different than looking back on the experience. And I think this was such a beautiful chat. Kristy, you are amazing. Lots of love for you out in the chat. Lots of hearts. Thank you so much. And we hope maybe you'll come back and visit us again. That would be amazing.
That would be wonderful. I really appreciate it. And I hope people found this to be helpful and informative.
You definitely were. You are awesome. So we will see everybody next week. I want to thank you all so much for tuning in. Lots of kisses, lots of hugs, and always remember, stay strong, stay positive. You are beautiful. And we will see you next week. Leave your questions. Bye.
Take care.
Bye.